Hey guys, today we're going to talk about the spine, specifically disc herniations. We're going to talk about what they are, where they're at, and some of the issues people may have with them. Also, there's a little secret that a lot of people don't know that you should know before you decide to have surgery on your joint. Let's get into it. What's up guys? Aaron Kasner, Doctor of Physical Therapy. Today we're going to talk about disc herniations. So, what are they? You know, you hear them all the time. You say, I herniated my disc, or I got a disc bulge, or, my back hurts. I was told I had a herniated disc. I'm going to have surgery. It's the end of the world, and all these things, right? Well, it's not really the death sentence that people think it is, okay? Yes, it can be bad. I'm not going to say that it's not. It can be pretty serious if you're compressing on nerve endings and you're having paralysis into your lower legs. Get it looked at. But if you're just having some common back pain, maybe don't jump the gun and go ahead and get surgery. But first, let me teach you about it so you can decide for yourself what you think is best. So we have all of our vertebral bodies. So this is our spine right through here, right? All these bones, okay? And then our disc sits in between them. So fun fact, when we're getting shorter as we age, it's because these discs become dehydrated. So yeah, you may only lose, let's say, a centimeter from each disc, but that adds up, right? You may lose inches at that point. So, fun fact aside, the disc, it's going to move as we move, all right? As this spine extends back, so as I'm extending and bending back, then the disc is going to be moving forward. It moves in this direction, all right? But as I bend forward and I come forward, the disc is going to go back and it's going to go to where these nerve endings are. So all these little yellow guys, these are their nerve endings that come down, okay? They branch off and they form nerves like your sciatic nerve and your femoral nerve, other nerves that branch off into your lower leg, okay? And then this is your sacrum. So this is the bottom. It sits on the inside of your pelvis, and this is your tailbone, your coccyx, okay? So what ends up happening is we get a disc bulge. So you see this little red guy right here. This is a show that must be a painful area because it's red, right, and all irritated. What ends up happening is as the disc can become dehydrated, or you have an issue with you're getting too much movement through the same vertebrae. So let's say I'm moving too much through here and not enough through these joints. I'm going to put a lot of pressure on this disc and it's going to go back and it could be herniated. Actually, here's the secret. A lot of people have herniated disc, but they're not actually causing any issues. So they did this big study where they took 50-year-olds, 70-year-olds, 60-year-olds, 80-year-olds, whatever, all the different ages with no back pain. And they wanted to take a look at what a healthy spine looks like. And they found that as you get older, you're more likely to have a disc herniation without any issues. So just because you've been diagnosed with a disc issue and you have back pain doesn't mean they're linked to each other. They could be, so let's try to work on that, but they may not be. So don't think, oh, I got a disc herniation, I'm gonna have to go in, I'm gonna have to get my spine fused, so it's no longer a problem. And spinal fusion is a whole other issue, because if you think about it, all these joints need to be able to move together, right? When they become overloaded is when other joints aren't doing their job. Well, if you get a fusion, so let's say these two right here are fused. So let's say L5, 4, 3, 2, and 1, all right? Let's say L4 and L5 are fused together. You're not going to get any movement through this joint now because there is metal there and it's not going to allow it to move. So what's going to happen? You're going to have to move a lot through what we call your L5, S1, and you're going to have to move a lot through your L3, L4 through here. So what caused the issue to begin with? Probably too much movement right here. Now you're going to put too much movement right here, too much movement right here. So what do they do again? Well, let's fuse it some more. So they fuse it up above. So they fuse L4, L3, L3, L4. They'll fuse L5, S1. Bigger issues. And you're moving up through here and you're stiffer and all get out and you can't do anything because your back hurts all the time. Let's try to avoid that if we can. There's some times where a fusion is needed, of course, okay? If that's the answer, that's the answer until we have a better one, all right? But I really recommend trying to get better before that, before jumping to the final thing where we could create more issues, okay? But don't think that having disc herniation is a death sentence, all right? Disc can calm down and be less inflamed and be less of an issue for people to where they can continue to live normal lives. But also know this, if you've had pain longer than 6 months in your back, it may not just be a disc issue, it could be a chronic pain issue. And that has to do with our nervous system and our brain, how they respond to each other. I got more videos coming to talk about that in the future. So if you think you have chronic pain, check those out and see if it can help you out. So that is the spine, that is your disc. There's disc through here, and these are this disc herniation that can be an issue. It can compress on your nerves and cause issues down the way. but it's not a death sentence. It's really common. They've called it wrinkles on the inside. Just as we get older, we may have wrinkles on our skin, we may have disc herniations in our spine. That's okay. But still, let's work on your pain. Just because it can be normal doesn't mean your pain is. So let's work on that, get better, get stronger. If you like what you saw today, click that like button, hit subscribe. Let's keep learning. Let's keep getting better. Let's keep elevating ourselves, all right? Thanks, guys.